Senator Burke, thank you. Gentlemen, ma'am, thank you for being here. Thank you for your service to our nation. Dr. Marks, it's nice to see you. I'll see you in the FDA and the appropriations process. And Dr. Kessler, thank you for your help in regard to helping us with the care for veterans. And we're working to pass legislation, passed the Senate last night with a conversation we had in our hearing about spouses and caregivers for veterans. So that issue that I raised with you is progressing. And Dr. Fauci, I didn't have enough of you in the appropriations process, so I've joined the Health Committee.
Great to see you.
Thank you very much. Let me just ask you a question, and then I think I'll visit with Dr. Lewinsky. It's going to be a bit outside of COVID-19, all that's related. So you better than anyone know the resources that NIH has devoted to combating COVID-19. The research and the response. I'd like to be reassured that despite that important work, that the other things that are important to America that are led by NIH research are not suffering. So how do you see the overall picture at NIH during this time of COVID-19?
I think I would not be totally frank with you if I told you that things are just exactly the way they were prior to COVID, Senator. There has been a diminution of activity in some areas for the simple reason that a lot of the clinical center, for example, is not going at full capacity for reasons that relate to the outbreak itself. As far as our grantees on the outside, we are continuing the same sort of support for all the other diseases that I know you're interested in. Cancer, heart disease, diabetes, Alzheimer's, Parkinson's, all of those are going well. But I think across the country, the same way that other areas of our society have been dampened down a bit by this outbreak, I think some of the research endeavor, by the very nature of when you shut down a lot of things, including accessibility, for example, of certain types of approach. But I want to give you my absolute promise, and I'm sure that Dr. Collins, were he here, he'd tell you the same thing. We give you our absolute commitment that we will do everything we can to make sure that nothing important slips in the other areas of research.
It's a matter of saving lives
Right.
with COVID and outside the other afflictions and diseases that
Right.
Americans are afflicted with. Let me turn to the CDC. Dr. Walensky, it seems important to me. I mean, I've heard while I have 3 hearings going on this morning at the same time, I've heard most of the testimony and responses to questions. And I certainly am a promoter and proponent of people being vaccinated. And I think that the CDC could be helpful if their guidelines for instructions and suggestions for those who have been vaccinated were current and consistent and timely. So what is it that CDC would tell someone today that their behavior or conduct can change, or what their behavior or conduct should be following vaccination?
Thank you for that question, Senator. About a week ago, we released our first guidance on first step on what you can do if vaccinated. And that included things like small visits in your home, visits with other vaccinated people, unmasked and undistanced, so that you could dine with other vaccinated people in your home. You could also visit with unvaccinated people as long as people in their home don't have high risk of severe disease. So that is, we are still looking at data regarding whether people who are vaccinated can be asymptomatically infected and potentially transmit to other people. In that case, we wouldn't want you to be living with somebody who was immunocompromised on chemotherapy and whatnot, because we would worry about severe disease in that household. We've also released guidance on the fact that you don't have to quarantine if you have been exposed and you are vaccinated. So the quarantine has gone away with regard to people who are being vaccinated. We're revisiting what we should do regarding travel. for those who are vaccinated, and that should be coming forward soon. That's going to likely be the next step in this regard. I want to remind people that we have now 12% of the population fully vaccinated, 39.9 million people. The initial guidance was released when we had 9% of people vaccinated. So as more and more people are getting vaccinated, as we are getting more and more data about the implications of vaccination with regard to asymptomatic infection and potential transmission, those guidelines will continue to emerge as you're requesting.
Let me suggest in the 2 seconds that I have left, or that I had left 5 seconds ago, that I would ask you to be concerned. This is true for every agency here that's represented here. A rumor in today's social media world, a rumor about a problem with a vaccine, a consequence, which could be false, but it is easy for fear to spread among Americans. You need to be prepared with the science and medicine to respond quickly to put down a rumor. And I hope that's the case in all of your circumstances.
Thank you, Senator Moran.